Traction is applied by a system of ropes and pulleys. So, most of the time we have observed traction. Common form of traction is skin traction. Here, the skin traction is achieved by clinging wide bands of adhesive tabs, not adhesive tabs, usually the band-aid, directly to the skin and applying weight to these bands. The pull of the weight is transmitted indirectly into the involved bone. So here what we are using is, we are using ropes, pulleys and the bandages or the wide type of bandages or the adhesive we are using for the skin traction. Most commonly used skin traction is Buck's extension traction, Briand's traction, Russell's traction. These are the three most common forms of skin traction used in injury to the lower extremities. Buck's extension traction. It is the most commonly used traction in adults. It can be used in one or both legs with 2.5 to 3.5 kilogram of weight per leg. So it is a traction that is used to treat fractures, realign broken bones, correct contractures or deformities, and for knee immobilization. Buck's extension applied to the distal end of the fractured lower limb. So here you can see the picture of Buck's extension traction. Here the pulling force, it is done by pulleys, minimum 2.5 to usually we are giving 2.5 to 3.5 kg of weight per leg. And this Buck's extension traction commonly used in preoperative traction, especially for hip fractures, pulling contracted muscles. Then relief of legs or back muscle spasm, this Buck's extension traction is used. Patient lies generally in recumbent position. Traction may be removed for skin care and if the fracture is present. So that is regarding the Buck's extension traction. It is the common form of adult traction, and here the used kilogram is 2.5 to 3.5, and it is the preoperative traction, especially for the fractures in the lower limb and used for knee immobilization, pulling of the contracted muscles, and the relief of leg or back muscle spasm. And here the patient in recumbent position, and traction may be removed for the skin care. So this is regarding the Buck's extension traction. Next one, Briand traction or the gallows traction. Briand's traction, which is a skin traction applied to both lower limbs, can be used to reduce the fractures of the femur in children under 6 years. So the Briand's traction or the gallows traction that is used for the children under 6 years. Both legs are suspended vertically with the hip flexed at a 90 degree and the knees are extended. The buttocks are slightly elevated from the matrices. Therefore, the body weight is used to provide the counter traction. It is not used for the children above 6 years. This is the another picture of Briand's traction. It is useful for the treatment of femoral shaft fracture, especially in kids. Here this traction nowadays rarely used. Brayton's traction is rarely used traction nowadays, and it can be used with the Buck's extension traction. Next one, Russell's traction. Russell's traction may be used in the treatment of fracture of the shaft of femur. It may be applied as either skin or skeletal traction. Russell's traction creates a forward and upward pull on leg by applying vertical traction at the knee. At the same time, a horizontal force is exerted on the tibia and the fibula. The knee joint is bent and the client can move about with relative ease with the Russell's traction. So here the Russell's traction, it is used for the fracture of the femur, and here the traction that is created forward and upward pull on the leg by applying vertical traction on the knee. The same time here the horizontal force is exerted in tibia and fibula, like Buck's extension. This is the another picture of Hamilton-Russell's traction. Here Buck's with the sling is used, and it is used in distal femur fracture in children. It can be modified to hip and knee exerciser. So in Hamilton-Russell's traction, it is used in the children with the sling. Other traction is pelvic sling traction. In pelvic sling traction, it is used in adults under the pelvis and buttocks like a hammock with 20 to 35 pound of weight. So here the pelvic sling, it is used under the pelvis and buttocks, holding the fractured pelvic bone, and also it is used in intervertebral disc prolapse. The buttocks must be slightly off the bed, and patients can be removed this sling whenever needed. Next type is cervical head halter. It is used in adults under the chin and around the face and back of the head with 2.5 to 7 kg of weight, and it is used in relief of muscle spasm caused by degenerative or arthritic conditions of the cervical vertebra or muscle strain. Patient may be in low or the high Fowler's position depending on the purpose of the traction, and it can be removed when the patient is in sleeping, and it can be used in the home also. So the cervical head halter, it is commonly used in the degenerative disorders or in order to relieve the muscle spasm. Next traction is Cottrell's traction. It is used in adolescents and young adults with head halter and pelvic belt. So in Cottrell's traction, there will be a pelvic belt and a head halter. Usually it is used in preoperative muscle stretching in patients with scoliosis. So in scoliosis patient, the traction used are the Cottrell's traction, and this traction cause pain or discomfort, and it can be removed for the massage and or the skin care. Next traction is Dunlop traction. Dunlop traction, it is used in adolescents and young adults on the lower humerus and forearm. Usually the weight is 1.5 to 2.5 kilogram weight. And here the realignment of fracture of the humerus or the forearm, it can be used. So that is regarding the Dunlop traction. Dunlop traction, it is used for the fracture of the femur. So the skin traction commonly divided in Buck's extension traction, Bryan's traction, Russell's traction. This is the three common tractions. Then other type of traction is pelvic sling traction, cervical head halter, then Cottrell's traction and Dunlop traction. Thank you.